Hey, what's going on? Dr. Chris here. Today I want to talk about the lumbar spine, some basics of anatomy and spinal mechanics. So let me orient you in space here. So this is the front, this is the back, this is the vertebral body. We've got a disc, another vertebral body. We've got the spinous processes here, the transverse processes, and these joints here, these are called facet joints. This is the spinal cord, and then we see this yellow thing exiting here. That's meant to be the peripheral nerve, which is cut off for the sake of the model. And you notice there's a hole where it exits that's called a foramen. All right, so spinal mechanics, you've got flexion or bending forward, extension or leaning back, left side bending, right side bending, left rotation, and right rotation. So we name the rotation on the way the front of the vertebral body is going, so that's left and right. And just notice on the back side here, that's the amount of motion in lumbar rotation right there. So what's not happening is that facet joint is not hopping over and coming all the way over here. So this idea that we're going to crack it back into place is not really what's happening. When you crack the back, you're just kind of releasing some gas bubbles in these little capsules that surround the joint. Okay, so what can happen often is something compromises this space and you get the pinched nerve, or we would call stenosis. Anything that narrows that space is stenosis. Stenosis means narrowing. Right, so you can get erosion here of the cartilage. You can get most commonly a narrowing of the disc over time. Gravity starts to win, and maybe dehydration over lifetime because there is fluid inside the disc. You start to get that where you compromise that space. And then the mechanics start to play into pain. So most people will develop an extension sensitivity because if that space is already compromised and then you lean back, you're going to compromise that space even more and close down on the nerve. Flexion, going the opposite way, you can see opens or gaps that foramen, so it gives some space back to the nerve. The same mechanics happen in side bending. So when I side bend this way, this side is closing down while that side is opening. And then with rotation, when I rotate this way, look at that, kind of hard to do, this side is closing and that side is opening. So this comes into play when you're having pain if you're extension sensitive. If you've done a bunch of back bending or side bending to one side, you can go the opposite way and reduce the irritation on the nerve.